much. I will be short. So this meeting, we had a 23% increase over our last meeting, and 19,859 delegates were at that meeting. We had, during this meeting, increasing membership. We now have over 10,000 members. It's 170% increased over 10 years, and most of this increase during 2014. But I guess you have been around, and what you see here is a community with a mission, a dedicated community with a mission to improve the outcome of patients with cancer. Now, all this growth is nice, but it comes to us with more responsibility, and we are ready to take this responsibility. Of course, we will continue with education, guidelines, and policy missions, but we have to expand that. One thing of expansion I communicated already, we will have an ESMO Congress in Asia, in Singapore next year. We met South American colleagues during the meeting, and we will have in South America clinical trial courses together with ESMO. Also, we have now a more important role for the patient advocacy groups. We had meetings during this Congress, and the patient advocacy groups will be directly integrated in the onco-policy groups of ESMO to be more powerful, to give them a better role. As I mentioned before, there's no advances without research, and we have to ensure that the research opportunity in Europe for academic research is maintained, but even better, it has to be improved, and we work toward this goal. And the first big step will be this clinical trials forum, which we will hold in Brussels together with EORTC, where we invite all European clinical trials groups to come together to work on the future. Now, of course, then all these advances is nice and fine, but patients need access to the advances. And we have to do the best we can to make sure patients get access to the future and to the new opportunities. You've heard we do that at the moment with a survey of what is the reality in access to current drugs. We started with Europe, but we agree here with colleagues from Asia and from South America to include a survey, make a global survey of the access to anti-cancer agents. And we will hope, with a magnitude of clinical benefit scale, which we're still working on, we work on since a year, we hope it will be finished in the mid-next year, to highlight those new drugs which have the highest impact for patients in survival or in other benefit. So this is how we move forward, and I'm sure we look forward to see you when we have our next Congress next year. Thank you.